Hello, my name's Nisha, and today I'll be talking about reviewing neurofeedback and transmagnetic stimulation for the treatment for ADHD. ADHD is a mental disorder which affects the brain and causes a normal level of hyperactivity and impulsive behavior. People that are diagnosed with ADHD often have trouble focusing on tasks. It is associated with low levels of neurotransmitter known as norepinephrine. This transmitter goes hand in hand with dopamine. That is also a type of neurotransmitter which controls the brain's pleasure and reward section. ADHD can also have an effect on both children and adults. It is estimated that 1 in 20 children in Australia suffer from ADHD. It is more commonly seen in boys than girls.
Neurofeedback treatment, also known as biofeedback, is a type of feedback which is based on the basis of activity of our brain. The feedback allows particular pattern of the brain to be rewarded with some type of stimulation, for example, auditory, visual, and tactile. This enables the user to modify the brain activity and work towards improving the source of unwanted symptoms. The brain produces a measurable electrical signal or waves like, and a practitioner of neurofeedback measures these waves, usually with a device called an EEG. The 5 types of brain waves, alpha, beta, gamma, delta, and theta, each have a different frequency, which can all be measured by EEG. Common mental disorder like ADHD occurs when your brain stimulation is reduced and the electrical signals or brain waves aren't working together in a perfect balance. Neurofeedback therapy helps in retaining aspects of the brain activity and bring it back. This therefore helps patients enhance their memory and focus and have a better mental clarity without severe side effects. Neurofeedback is immensely effective in the majority of cases and provides significant results. A study by Arns showed the impact neurofeedback had on a brain activity. This study concluded that neurofeedback leads to large-scale improvements in the attention and impulsivity, and some significant improvements in hyperactivity. The study overall suggests that neurofeedback treatment is very effective for the symptoms of ADHD. As this disorder affects all kinds of age range and sex, this treatment targets all kinds of audience, for example, practitioners, students, and clients. Similar to other treatments for neurofeedback, although it being very effective, also includes a few side effects and has its cons. Even though it shows significant effectiveness for ADHD, researchers have concluded that the validity of the treatment is questioned in terms of long-term effects, and more evidence is needed to prove that it's completely effective. Although the treatment is non-invasive and safe, it however does sometimes include adverse side effects. For example, fatigueness, vivid dream, dizziness, nausea, and light sensitivity for the patients who have experienced head trauma. Furthermore, it is an expensive procedure, which is not covered by many insurance companies, and is also very time-consuming, while also the benefits are not very long-lasting, and it may take various months to see desired improvements. Now onto the second treatment option for ADHD. Transmagnetic stimulation, or transcranial magnetic stimulation, TMS, is an alternative neurostimulation technique that explores cortical physiology in humans and investigates various intracortical inhibitory and facilitatory networks and cortical-cortical connectivity. In other words, it's a non-invasive treatment where magnetical impulses stimulates neurons and work towards rewiring neural pathways. TMS is being used more in children and adolescents' development, and evidence also supports how the use of TMS improves the understanding and managing of drug resistance for ADHD and other mental disorders. TMS was seen to be incredibly effective and showed remarkable results. A single blind control study by Helfrich included 25 children from the age of 8 to 12 with ADHD that received sub-threshold of 1 Hertz RTMS to the primary motor cortex. The results showed promising effects of the RTMS effect on the cortical excitability in children with ADHD. This study concluded TMS may prove to be useful in various conditions of child and adolescent psychiatry. However, more research should be investigated on the developing brain for any precautions, as the children's are included. Although recent studies, TMS is seen to be effective and safe, it does have its limitation and side effects. For example, the most common reported side effects are mild scalp discomfort in the area where the treatment is done and headaches. These side effects, however, are noticed to subside after a few weeks and can be managed through the painkillers. Some of the treatment options for ADHD are prescribed medication, behavioral therapy, and psychotherapy, and educational techniques. Medications are the first choice for ADHD, which helps treat the core symptoms. People who are non-responsive to the medications go forward and try psychotherapy and behavioral therapy and non-invasive techniques such as neurofeedback therapy and transmagnetic stimulation. Due to the short-lived span of all the treatment available, new approaches are needed to improve the accuracy. For neurofeedback treatment and transmagnetic stimulation, it is essential that more studies regarding the validity of the personalized treatment are needed that could help in the clinical practice to improve the treatment efficacy.